All right. Well, I think a lot of people have started joining, and probably a few more will trickle in the next few minutes. But we'll go ahead and get started. So, welcome everyone to today's CWORPH webinar session. I'm Casey Ballio, and I will be the moderator for today's session. The presentations today share research from year 2 of the HRSA and CDC Public Health Workforce Research Center Award, conducted by members of CWORPH. CWORPH, or the Consortium for Workforce Research in Public Health, is a consortium of 6 universities: the University of Minnesota, Columbia University, East Tennessee State University, Indiana University, Johns Hopkins University, and the University of Washington. And we are funded by HRSA and CDC as a national health workforce research center that focuses specifically on public health. We bring together academic and public health partners to conduct the rigorous research required to ensure a well-trained public health workforce ready for both chronic and acute public health needs. During this session, to ask questions, please bring up the Q&A window on your Zoom application and ask questions there. We will note them and respond to them at the end of the presentations. Presenters may also respond to some questions in the Q&A window during the session when they've completed their respective sessions. Please only use the chat message to message the host about any technical issues that you might be experiencing. We also are offering closed captioning during the live webinars, which you can manage your closed captioning settings in the Zoom application toolbar on your own screen. After the webinar, we will distribute the slides shortly after the meeting to all attendees. And this audio and video of the webinar will be recorded. If you would like to review this material later, you can go ahead and do so. It will be available through our YouTube channel. The link will be shared in a follow-up email within the next day or two. And you can go ahead and subscribe to our email list to receive alerts about additional webinars and projects. And that link will be posted in the chat as well. So we will go ahead and jump into the session for today. We have 3 presenters, starting with Dr. Valerie Yeager, who is a professor in the Department of Health Policy and Management and the director of the Center for Health Policy at Indiana University. She has a DRPH and MPH from the University of Alabama at Birmingham and a master's in philosophy from the University of Stellenbosch in South Africa. Prior to completing her DRPH, Dr. Yeager was a Lister Hill Policy Fellow at the Centers for Disease Control and Prevention in the Division of Global Migration and Quarantine. Next is Beth Resnick, who is the Assistant Dean for Public Health Practice and a practice professor at the Johns Hopkins Bloomberg School of Public Health, Department of Health Policy and Management. Her research and practice interests include assessing and improving public health infrastructure capacity, addressing harassment against the public health workforce, and advocating for public health worker recruitment, retention, and well-being. Paulani Moy is an assistant practice professor in the Department of Health Policy and Management, also at the Johns Hopkins Bloomberg School of Public Health. She also serves as the associate director of the school's Office of Public Health Practice and Training. Paulani is a practice-driven researcher and educator whose work focuses on advancing public health workforce capacity, well-being, and infrastructure. So I will go ahead and stop sharing and pass it over to Beth Resnick to kick us off for today.
Thank you so much, Casey. Good morning, everybody. Excited to be here and share some of our findings. So what we are presenting today, it's going to be a joint presentation with our Hopkins and Indiana, University of Indiana School of Public Health research team, which was great. Part of the benefit of this consortium is that we were both doing projects on recruitment. At Hopkins, we were focusing on innovative solutions. In Indiana, they were talking about hiring laws and how those play out, and we decided to combine. So we'll just be doing one presentation for you today, sharing both of our findings and our collaborative work on this topic. So next. Thanks. So we are, as I was saying, we combined our projects, which I think was really great, and we'll be able to share why. So the one was talking about recruitment and partnerships and how that could be bolstered, and then the other was about civil service requirements on workforce recruitment. The combining of these has really helped us go deeper into two things that I think hopefully you all will find valuable. One is innovative solutions. We all know that there's lots of problems, so we didn't want to just rehash the things that all of us already know, but more thinking about opportunities of how people could do workarounds and solutions to trying to improve their recruitment, and also to be able to drill down deeper than just we can't, we're having trouble hiring somebody, to really look a little bit more in depth. And I think that this work has really helped us and will open up additional questions and areas to continue to look at and sort of think about, again, how we could get to better solutions to improve our processes. So just briefly, I'll tell you our study design. We did qualitative interviews with governmental and public health employees from both state and local. We used a semi-structured interview guide, and as you all know better than we do, that the structure of the public health system really varies depending on how you're organized and what states you're in, whether they were state or local level. So we really made it to be semi-structured so that the questions could be most appropriate for whoever we were talking with. And as you can see here on the slide, the types of things that we were asking about what they were currently doing around recruitment, what things had worked. Could they share with us how some of their civil service systems might impact their hiring processes, either good or bad, and sort of what the implications might be, and how people may have changed these things. So again, we were really trying to focus in on some solutions and innovations, because again, I think many of us are familiar with the problems, and getting a little more digging deeper into the what next. So kind of trying to unpack some of these layers. Again, as you know, it can be very complicated. So we're excited to share our findings with you today. And just lastly, on our recruitment, again, I think this is not going to surprise you. We worked with the Association of State and Territorial Health Officials, their workforce committee. Our team has had many decades of work in the public health workforce, so we were using some of our contacts. And then, of course, every interview we would ask if there were other people. We also tried to do a cross-team interview, so including hiring managers as well as human resource, HR people, so we could get different lenses into the hiring processes. And I hope that you'll see from our findings that I think we were able to see some deeper into the process to hopefully give you some helpful approaches and strategies that people are using. And then lastly, just the key informant, who did we actually talk with? We ended up having 28 key informants, again, as I said, from both state and local. Again, we tried to get a pretty broad representation across all of the US. As we said, we know it's different in different places. Primarily, they were decentralized states, but again, there was some one shared and one mixed. And as I mentioned before, trying to get a cross-section across the hiring process with different roles. So for example, hiring a program manager who might only be involved in the process when they have a vacancy, which might be, not very often, versus an HR person that is focused on hiring. That's their focus of their position. So that's what we'll be sharing with you today. And then lastly, what our analysis, and again, this was really helpful having the two research teams from Indiana and Hopkins to be able to conduct the interviews as well as analyze the themes, and then review everything again. So hopefully we've done a pretty quality job and have really thought through some of these issues, but we would really encourage you all as we go through to please post some questions and have some dialogue after we present, because it would be great to get additional feedback and your thoughts on what might be working and what maybe some of the other barriers might be. Next. Great. So now we're going to get on to our solutions and innovations, and I'm going to turn it over to my colleague Paulani to share that with you. Thanks.
Thanks, Beth. So I'm going to share more about our findings specific to recruitment strategies and innovations, and then I'll turn it over to Val to discuss findings on the role of hiring laws. So the recruitment innovations and strategies that were shared fell within three main categories: marketing, workforce development and HR, and hiring process innovations. So I'll start with marketing first. So there were a number of marketing-specific innovations that were found to improve recruitment practices, and these included leveraging external online job platforms, utilizing job wrapping and social media for broader reach, and engaging in strategic networking and partnerships. And I'll do a little bit of a deeper dive into each of these. Next slide. So in addition to officially listing vacancies on health department websites, some agencies share that they've started posting vacancies on external online job platforms such as Indeed and LinkedIn to really help improve visibility and reach when recruiting. And so while agencies often have restrictions on official health department website postings, there's usually more flexibility when posting externally. So they're able to make the posts more attractive and also intentionally use plain language descriptions of the job responsibilities as well as modified job titles to be able to clarify the position and the work for applicants. And this is a quote from one of our key informants on how they've used LinkedIn Recruiter as a tool to help them strengthen outreach efforts. Next slide. Another marketing innovation shared was the use of job wrapping, which is essentially a form of direct wire posting where new job listings are automatically pulled from health department websites and simultaneously posted on selected external job sites and recruitment platforms. It is fee-based, so you do need to ensure that there is funding available to support this. But because it is automated, it's helpful in ensuring that there are consistent job listings and also real-time updates across platforms. And as you can see from the quote, job wrapping can successfully help to increase visibility and also really bring in more applicants for a particular position. Next slide. So social media platforms such as Facebook and Instagram were also noted as an effective strategy for increasing reach. And so similar to what I noted previously regarding the external job sites, agencies likewise have flexibility around social media platforms to be able to adjust their descriptions and their postings and titles to make them more attractive. And they can also leverage these platforms to do more targeted recruitment to specific populations and also highlight the value of working for a particular agency. Next slide. And the last marketing innovation I wanted to touch on is strategic networking and partnerships. And so this not only includes building stronger partnerships with academic institutions, professional associations, nonprofits, and community-based organizations, but also more innovative strategies such as recruiting for hard-to-hire roles, such as dentists, nurse, physicians, by networking with healthcare professionals who are nearing retirement, but who still want to continue working in a reduced capacity. So for example, as shared in this quote from one of our key informants, one way to approach this is to partner with the State Dental Association to recruit dentists who are planning to retire from private practice to work a limited number of days in, for example, health department clinics or mobile outreach clinics, which still enables them to care for patients without the additional burden that comes with running their own practice. Next slide. So moving on to innovations related to workforce development and HR adjustments, one strategy shared here was to use FIG funding to establish paid fellowship programs as a recruitment tool. And so this really allows agencies to provide experience to potential employees, but then also more easily recruit high-performing fellows into permanent positions after their fellowship ends. Given how long it can take for hiring to actually complete and actually go through that process, it's usually faster to transition an existing fellow into a full-time position. Next slide. Another innovation shared around this was specific to compensation adjustments. And so specifically, we heard about the integration of pay-for-performance models into annual performance evaluations, which can help not only increase accountability, but also create a more motivating environment that can improve both recruitment and retention efforts. Additionally, some agencies are also engaging in market salary research to ensure that there are competitive salaries, as well as raises and benefits in alignment with other sectors. And some agencies opt to hire an external consultant, as noted in the quote, while others are opting to conduct that research in-house, depending on their capacity. Next slide. A third strategy that was shared was the expansion of benefits to include educational reimbursement. And so this quote is, I think, a really good example of an organization that is really focused on empowering their staff on this front. So their educational support policy not only includes 2 courses a semester, but also 1 day off a week for up to 40 days a year for course-related activities, eligibility for salary increases after completing courses, and continuing education support where they cover credits as well as initial certification. And so this is just one example, but doing things like this can not only benefit existing staff, but also can help attract candidates who are looking for growth and advancement opportunities, And then it also shows potential hires that the organization is invested in their personal and professional development. Next slide. Another innovation shared was around expanding the role of HR beyond recruitment, hiring, and benefits, so their typical roles, to also include team members who are focused on workforce development more broadly, and also as well as the retention and development of existing staff. So in some cases, hiring individuals who have been private sector HR folks and who have that experience coming in has also been helpful because they can bring a different perspective and approach to workforce development as well as talent management that can also help improve recruitment and retention and bring forward better organizational effectiveness. Next slide. And finally, in terms of innovations specific to the hiring process, so strategies shared here were focused on improving the applicant experience overall. And this includes making applicant portals more user-friendly where possible, providing transparency in pay, both in job postings themselves, as well as during the interview process, utilizing clearer job titles and descriptions. So similar to what I mentioned earlier around incorporating plain language into job descriptions and tailoring to different audiences. And then finally, ensuring regular communication with applicants throughout the hiring process. So for example, updating them on their status at different steps versus leaving them waiting for long periods of time without any updates or follow-up. And together, these strategies really aim to make the recruitment process more transparent and also more candidate friendly too, which can help attract and retain stronger applicants. I'll turn it over to Val to take things from here.
Thanks, Paulani. So we were also exploring the role of hiring laws, building on our project from year one that cataloged the laws that impact the hiring of the workforce. And ultimately, what we found is that while the laws are sometimes not specific about civil service exams, it might be documented that civil service exams can be used. When we talk to HR and hiring members about the role of civil service exams, we found that they too had a lack of clarity around this hiring legal requirement. We did hear some say that the exam requirements can deter applicants from applying. There are some settings where the application requirement is in place and all applicants have to complete a type of exam before they can apply to different positions. And so some of that lack of clarity makes it more time consuming and may deter people from applying for these positions. The quote that we have that exemplifies this is on the right here. Depending on which classification, the exam process itself can look a little different because we might have to have a subject matter expert review and score those applications for some of the classifications. Some require some of those nuances, and maybe it's a classification that they're not using frequently. And so they might only have 5 people in that classification, and they may only offer the exam for that position 5 times a year. In that case, it can be challenging because if there's a vacancy and there's a need, then they need to align the vacancy and the job posting dates with that exam administration process. So it can delay things or complicate the process. We also heard that the hiring laws sometimes have implications for organizational authority or responsibilities. And some of this is about not the details that are written into the law itself, but the regulations of how they are put into place. So the authority for hiring and hiring responsibilities may be, has the potential to be pretty impactful on the hiring process. And it's across these 4 different areas. So where the hiring authority sits and the systems that are used have the ability to complicate efforts to try and improve that system. So one example that we heard was that while we recognize that the hiring platform that applicants are submitting their materials through is complicated and antiquated. We have ideas of how we'd like to change it, but we don't actually have the decision-making authority about which system to use. So while our state has chosen to make improvements to that system, they chose a different system than we would have selected. And it still doesn't provide us some of the data that we need to know where people are dropping out of the process, or what challenges they appear to be having with the application process. On the budget approval side of things, if the organization has rules in place that require different levels of budgetary approval, it can also, once a position is identified as something that they need to hire for, go through periods of time that take a while to get all of those approvals in place. The position creation process itself can also, depending on the regulations, require that there's even legislative approval to create a new position. And the quote that we're sharing as an example from this theme is actually related to this position creation process. There's more work up front because we have to determine whether or not the classification that the hiring manager has proposed is appropriate. And so it might take more back and forth with the program, looking at the duties, making recommendations. Possibly if we don't think it's the appropriate classification, we have to go back and forth for more edits and discussions. And sometimes there's also reorganization. So if there's a group of new positions, we commonly have reorganization requests, and those packages can take months to work on. So there's a lot of pre-work with the program before a position is even posted, which can delay getting someone into a role that needs active work. Oh, sorry, one last thing. And then we also heard that the way that the organization sets up the applicant ranking or prioritization process can sometimes slow things down. So say, for example, the HR team does the initial review and make sure that people meet the minimum qualifications for the position. Then they provide a ranked list of individuals who qualify for the position to the hiring team or the hiring manager. And the hiring manager then begins their process of conducting interviews. And at that point, they start to find that people have either moved on, or they learn that it really doesn't look like the individual has the right qualifications. And so there can be delays by having to go back and look at other applications or review some of those that initially didn't meet the first screening again. And so this process can go back and forth and take a while, depending on how the organization has set it up, which isn't necessarily based on the way the law is written, but is an organizational process that they have in place that can slow down the hiring process. It also can be that they get to the narrowed down list and they find that those individuals do not align with the salary that they are able to pay that person for. And I think I'm talking about that next as well. Actually, it's back here. So, for example, when you have, as Paulani was saying, a wide range of salary posted for a position, individuals will apply thinking that, oh, this meets my financial expectations. But once they've gone through the review process, the individuals who have reviewed that applicant know along the way whether or not that individual is going to meet the highest level for that salary or not. And if during the hiring process, they can informally say, if you're offered this position, this is approximately the salary we'd be able to offer you. It helps because if that individual says that's too low, they can continue on with their screening with other candidates. If they get all the way to the end and the salary decisions are talked about at the very end, oftentimes some of those other candidates have already taken positions elsewhere because the process has gone on for so long. So by being able to talk with applicants informally about where they would actually fit within the salary range earlier on, it helps them to sort of avoid some of those delays that are going to make them go back again and start over. The third category within this consideration of how do the laws impact the process are things that organizations can put into place themselves as organizational process change. So there are some things that don't require a change in the law or a change in the regulation, like automating certain components of the process, the review process of applicants, streamlining the process in a way that they have certain criteria, and the individuals who are going to be the decision makers on the back end get to inform the application review process earlier on so that they don't have to go back and redo it after someone else has gone through all the applications. Communicating the hiring timeline with applicants can be helpful because they learn early on sort of what to expect and whether it will meet the timeline of the individuals they're interested in. And creating updated applicant portals so that the individuals who are applying are not going through redundancies in the types of information that's, like, say, for example, already on their CV. We've heard in previous studies that applicants can be frustrated by these hiring systems within government because everything that's on their CV, they have to individually type into the application portal. So if we can make those changes so that it's easier for people to apply, they're getting more communication throughout the process, and they don't feel like it's just a black box that they've submitted their application to, they remain more engaged and interested in those positions. So one other thing that we learned, and the first quote speaks about, is that even when they've hired an individual, sometimes there can still be delays until that individual begins doing the work. And that might be because of the onboarding process. So if your onboarding process is an in-person experience that's only taking place once a month, and you missed the previous one because of the date that they notified you you're being hired, it could be a month before the next onboarding process. So that's a month that that applicant goes without income. It's also a month that the work of that position isn't getting done. And so some agencies have made this an automated process instead of something that has the individual application or the individual presentation of all the materials over a week or a few days. And by building some of these automated processes into place, it helps to facilitate a quicker onboarding for individuals. It also makes sure that they're getting consistent information. We've, in previous work, spoken to employees who felt like they never really understood the rest of what the organization does or how to interact with other members of their agency. And so when you build these automated systems, you're ensuring consistency, and you're also able to provide people appropriate information that they can go back to because they're saved on things like a SharePoint site that has the kind of information that people might need over time. So in discussion, we want to just highlight some of the innovations that we also learned had something to do or were related to some of the FIG funding. So those job wrapping innovations, the automated job postings, as Paulani mentioned, some of those are fee-based systems, and the FIG funding facilitated the ability to use those things for some of the agencies. Having the ability to establish paid fellowships gives agencies using this FIG funds the ability to give new interested individuals an opportunity to work within their agency while they're figuring out how to navigate the hiring process or waiting on the process to go through its appropriate steps. Having some of the FIG funds for some agencies is contributing to their ability to provide education reimbursement benefits, although we did hear about instances where those education reimbursement benefits are being provided statewide and are not related to FIG funding. And another benefit of the FIG funding, for some agencies, it's ensured their ability to add to their HR team in a more diversified way. So we heard that beyond just establishing the administrative processes or the administrative application of each thing that has to be done. We now have, in some agencies, HR team members who can work on improving job satisfaction and workforce development differently than just handling the administrative process of getting jobs posted and reviewing applications. Findings provide us early evidence that this FIG funding is having an impact for some of our agencies and that it's supporting some of these innovations. It highlights some opportunities for further development, and it may be meaningful to some of the agencies who haven't done some of these or implemented some of these innovations to date. But in order to close some of these workforce gaps, we're going to need to have both financial strengthening for public health, but we also have some structural hiring challenges that may be state-based or need to be realigned with their hiring authority within the state. And that's what we have for you.
All right. Well, thank you so much to Beth, Paulani, and Val for talking about these two projects from last year. I'll kick us off with a question and then we can jump into the Q&A. As a reminder to everybody, if you have any questions, feel free to put them into the Q&A part of Zoom, which should be available at the bottom of your Zoom bar. So to kick us off, I think it might be helpful to think about sort of what the first steps are that agencies can take. I know both Paulani and Val, you all talked about some things that are more structural and some things that might take changes in policy or changes in sort of major structures, and others might be a little bit easier to get started. So I'm wondering if both of you can just sort of speak towards what might be the first steps that an agency can do to sort of remove some of these barriers and really jump into some of those innovative practices.
You want to start, Paulani?
I'll defer to you to start.
Oh, sure. Thinking about what, ways to recruit that might be meaningful and easy are using those social media platforms. If they need permission or need to go through a higher level authority to get the ability to use something like job wrapping, or if they don't have FIG funds, which we know lots of local agencies didn't receive FIG funds. So they could use those social media platforms and the hiring platforms. And if they have the ability and the time, they can tailor their job postings out in those settings. They have to meet the rules of the hiring authority within their state or county in how they officially post them. So the specific types of titles, which we've heard previously, aren't really easy for individuals who are interested in the work to understand. So they don't know that that job would actually fit their expertise. But using renamed or differently described postings on those external websites would be beneficial. Beth, do you want to add?
Yeah, thanks, Val. And thanks, Casey, for the question. I think backing up even a little bit more, I think just a fundamental shift in thinking. And I think it's great that some places are already doing this, as we've already shared, but considering, like, number one, recognizing, hey, this is a real priority and we really need to think about it in new, innovative ways, and that the people who are applying are our clients in a way, like, as opposed to just they want a job from us, of they are our clients. And it's also a face of public health, right? So in my other half of my brain, I run a master's program where my students are looking for jobs, and they're so vulnerable when you're applying for a job. So even just a little kindness, not even having to offer them the job, but like communicating to them. And I think there's a question about that in the Q&A, but that can be a way to build a rapport for people to understand public health and have a positive attitude toward it right from this get-go. So just some common courtesy. And again, I know we talk about money. I know that budgets are tight in many years in many places. And federal funding is all now in limbo. So the concept that some of this doesn't need to take much money, but more just a different approach. So an example might be, I think this relates to the question in the Q&A about communication. having an automated answer, right? When someone puts in their application, this is a real challenge I've seen with my students applying for jobs. So if there's a closing date on that application, saying, hey, we're so happy that you applied. Thank you so much for your application. You will not hear from us until the job date, till that closing date. Bam, right there, you've already given that person so much more information, and it doesn't take any money there. That's an automated response that's probably already feasible within the system that people have. So even just some of those key changes like that, and again, thinking about the job applications as your clients, really just sort of can change the whole perspective on how you might approach things. So I think that's really important. And then, of course, as Val was talking about, digging into your systems more. And that obviously is a much bigger overhaul. And some of you, don't necessarily have control over that. So again, trying to think about what you can control and what maybe would take more, and separating those into two buckets rather than, I know we all do this, and universities have horrible hiring systems as well. So I'm guilty of many of these things myself. Is rather than just saying, oh, it's HR, I can't do anything about it, out of my control. I know we did speak with somebody who was able to get access to who had applied to their position. They were in a local health department. And so they were able to just send those emails to those applicants directly, and not upsetting any of the ongoing process. Like, hey, you're going to hear from HR soon, but I just wanted to let you know we're really interested in you. And please let us know if you have any questions or if you have other offers. And, so again, developing that rapport, that's something that person was doing on their own, not circumventing any processes, just asking for permission to be able to see the applicants in advance of the, or as the ongoing, I guess I would say, iterative, as the applications were coming in.
And that doesn't require putting a system change in that has an automated email that goes out. That's human effort. But it also requires relationship with your HR team. And so if you're in a big organization, that HR team is probably pretty busy, and it might be creating extra work for them to be able to give you those lists early or as the applications are coming in. So there's some, political will that people have to use to sort of ask to make this process better, and find the ways that are feasible to try and communicate more with people along the way. Because I think that's some of what we've heard from individuals is that they submit an application and sometimes they never hear anything. So if we can begin to find ways to communicate earlier and then more transparently throughout the process when it comes to things like the salary range that we would see you meeting the criteria for is probably this, not this, would be helpful for people to, if that person's no longer interested, then they'll move on, and that hiring team is no longer spending their energy trying to recruit someone who's not going to take the position. Did we answer your question, Casey?
I think so. Thank you all very much. And we'll jump over to the Q&A. I know, Beth, you started to speak to this, and Val, you did a little bit towards the end of your presentation. But the question's from Jamie Williams about communication with the applicant throughout the process. And if you all have any other sort of suggestions or anything else you heard from participants of the study on how and when and what to communicate with applicants.
Yeah, so I think in general, the biggest challenge for people looking for jobs is that they get ghosted. They don't, they send something into the black hole and they never hear back. And that happens, I see it with my students across, not just in the government sector. So I think this is an area where if you just even do the smallest bit more, it can really put you ahead of other places. So, and again, thinking about young students that are in their first jobs, or maybe somebody nearing retirement and they're anxious about transitions, are always anxious for people. So just to be able to give them, hey, we got your application, thank you so much. Even if you say, I'm not sure when you're going to hear from me. But I want you to know that I noticed your application and I'm going to be keeping an eye out. That would be humongous. Like, again, so even if you don't have that information, wording it with the way that you care about the person, again, thinking about them as your client. Now, you're not going to necessarily be able to do that with every single applicant, but maybe the ones that you think are the best ones. And as Val was saying about pay, transparency, and again, we get so anxious about, I don't know what the answer is, but at least to be able to give them like, hey, I can't tell you the exact salaries, but I know it could be in this range. You've now saved everybody so much more time because if it's way out of range, you're wasting everybody's time to keep on going, right? So I think just some common sense and courtesy about how would you feel, right? So and I get it that we can't share out information that HR might have to determine, but even to saying that, I think makes a world of difference. Also, something we hadn't really talked about, but if you're recruiting people, sharing information with partners, I know I've done some work with our state health department and local health departments in Maryland, where we're based. Hey, if any of my students are applying, I'll forward an email to my contact and be like, hey, here are 3 of my students that have applied to your position and here's your resumes. Here's their resume. So again, like finding other ways if you can't build those relationships that Val was talking about. Say it's at your state agency or a different agency that's doing it and you don't have any contacts there. Finding out, who's applying for the job, and that way you can know at least to keep a lookout and making connections. So again, you got to get innovative, right? And think about all the different ways. I don't think there's one answer. And all of you are in different agencies that are structured differently.
Jamie also had a question about keeping the applicants motivated. I think that's what Beth was just speaking to, Jamie. It is time consuming though, as you can imagine, if you're part of the hiring team, the HR team, or the hiring manager from the program, being on it and doing your own work and doing all the other things that you're meant to be doing, plus trying to keep people motivated, is work. I do think what we heard from some of the HR teams, because they now have a bit of a broader team, and it's not just the exact administrative work that they used to, it was a little more narrow. They do have people who can spend a little bit more time doing some of that, interacting with the social platforms or the recruitment platforms. And so that seems to be meaningful for them. They feel like it's helping to get more applicants in and then to make the process more successful in the end.
The other thing, I would reiterate what Val said, it is a lot of work, but on the flip side, the investment up front, if you to have better team members and building that camaraderie even before you've onboarded, and say you do all that and then the person doesn't take the job, you have still created a rapport and developed a relationship, right? That might come back at some point. So again, thinking about this in a long term. We did hear something, and then I actually heard it reiterated to me. I heard it in an interview in one of these with the health department, and then I had it reiterated to me here at our university, that they are seeing a trend of people going all the way through the process, the applicant, and then not accepting the job or ghosting the employer, just like going all the way through and then not showing up on the first day of work. So again, I think building these relationships up front, because if you had something like that happen, that's a lot of time all the way through. And then you have that, as Val was saying, that position is empty and then the person isn't showing up. So again, if you have built this rapport beforehand, I think the chance of something like that happening would go down. So, it is a lot of time and effort, but I think we have to recognize that this is a priority if we want to have good people on our teams and that start out in a good foot. So, again, it's tough. I know we have to do a lot of different things, but thinking about this as a priority. And then we are also doing some work in our year 3 and some of our other projects on worker well-being. And this is also that first step of trying to create a culture where you're sending a message to your applicants that you already care about them right from the get-go. And I think that that's an important mind change that we really all have to be thinking about, that our people have to be prioritized.
Thank you both very much for that. The next question, I think, is to Paulani and Beth. So you all talked about sort of three different areas for strategies or innovations. You talked about marketing innovations, workforce development innovations or HR adjustments, and then hiring process innovations. Is there one of those that is sort of the most important or needs the biggest changes, or is the first place to start from your all's perspective?
All of the above. No, I think it also depends on your agency and what you have support for. So again, back to my point, and Paulani, you can chime in if you would like, what's in your control, right? I think all of this is so important. What's in your control? How many vacancies, how much is recruitment an issue for you all too in the first place, right? So how many vacancies do you have? Is your current staff overburdened and this is like a key priority? Again, it's, there's going to be a lot of contextual, but I think just using sort of the basics of like, what can we control and get to first? I mean, obviously some of those social media, job wrapping, plain language, those are things that you can probably start on right away. So I would say those are probably the easiest ones, versus if you're going to shift your whole systems and structural changes, like some of the stuff that Val was talking about, and obviously law changes. Or maybe there's some kind of hybrid, like for the exam, and I know certain states have laws about that you have to have the exam and you can't get rid of it. Could you advertise it instead of an exam? I know in some places they've changed the exam. Val had some examples of that. So you don't, on social media, you don't call it an exam. You say that there's a assessment to help you figure out what job you want, or, help us pair you. Again, how you frame these things could be different. So it's not, you're not breaking the law, but you are communicating it in a different way. So I guess bottom line, my answer would be, what is the two things? What could be in your control right away, and what the context of your agency is in terms of what your needs are. And that's how I would prioritize it. And I don't know, Paulani, if you want to share anything else.
No, I think that covers it all, but I think I also just wanted to highlight framing is actually something to keep in mind too. And like something that we heard, even going back to what Val had mentioned around like social media, for instance, is one way to approach that too, is thinking about highlighting the value of working for a particular agency, not just the position itself. And so what we've heard from some folks is like, okay, well, we'll speak to existing employees, have them share testimonials about their experience and why they're dedicated to working for a particular agency, and using that as a way to highlight why an applicant should apply.
Yeah, great point. I forgot about that. Good point. Yep. That's the benefit of being in a public health agency, right? The mission, and why people care about working there. So elevating that piece too, especially if you're not going to be able to match the salary, sharing the value, and then the quotes from your current employees. And that's also a way to target certain populations, right? If you have some younger employees or employees that are different ethnicities and different populations and targeted types of employees. So that's a great point, Paulani.
I know we're wrapping up, but I am curious if Paulani and Beth and I have been intimately involved in this work for some time now. So I am starting to wonder if these are new ideas and new thoughts for others. They feel like they're not new to me at the moment. And so as we've been talking through it, I'm hoping that this information is valuable and meaningful to others. And if folks have feedback about it, or if there are things that we haven't covered that are innovations or challenges with the laws in your particular area and what that means for the hiring process, we'd be happy to hear from you. So feel free. If you disagree with the things that we've said and these things are not applying to you or cannot work in your setting, we're also happy to hear about that. So if some of this stuff feels pie in the sky and these things aren't going to work for you, understanding your experiences is also of interest to us. We want to make sure that some of the summaries that we've put out are meaningful to the field. That's why the work is being done. So if you have any interest in speaking with us, you can certainly reach out to us. We're easy to find.
Thank you all. I wanted to ask a little bit about the sort of role of connection and connections with schools and programs of public health. You all talked about sort of transitioning fellows or interns into permanent roles, and you also talked about educational benefits. So I wondered if any of you just wanted to sort of speak to what is the potential role of schools and programs, and how can those relationships start?
Yeah, absolutely. I mean, being out of school of public health, of course, we're like, oh, this would be terrific. And I do think it is good to build those relationships and share information. Just an FYI for all of you that many schools of public health now have online programs and different, so their students can be from all over the place. I know, we have students all over the country and the globe. We have many online programs. So don't only think, oh, I can only approach institution that's right near my department. The other thing, though, that might sound contradictory, but I don't think it is. I think what people are seeing is that, especially in the smaller rural areas, it's really helpful to grow from within their own community. So again, trying to think about maybe community colleges, other things, to build more connection within your own home environment to find people. So again, the context of where you are is really, really important. But I think, as Paulani was mentioning, those fellowship programs, some of the departments we had were able to set up these internships that were terrific. Even if you're not able to convert them to jobs, although ultimately that was the aim, you're also just, again, building a bridge from public health to the schools, and then those people, no matter where they end up going in jobs, having that public health knowledge and how agencies work is so important in terms of building bridges. I think we all saw during COVID, right, where we needing to understand how all these different systems work. So that was a great thing. And again, just sharing information about your agency, and letting students know about the jobs. And again, that social media platform also, I think, is a great way to connect. So I don't know, Val, if you want to share anything else about specific.
I just want to mention that publichealthjobs.org is also something that we talked with folks about. And it goes back to what Beth just said. While publichealthjobs.org does have positions all across the nation listed on it, and it is a really great resource for those who are out there looking for jobs to be able to see what's available, many of these agencies have found that they're most successful recruiting in their own environment. And so their specific social networks, or the folks that they're connected to on LinkedIn who are within their region, are more likely to apply for their jobs. And so that's why we were hearing more about those than we were really hearing about publichealthjobs.org. Certainly, if people are interested in moving around the country, if Beth has a student who's in Maryland who wants to move to California, publichealthjobs.org can be very meaningful in finding those jobs that are open in California. But for those smaller county health departments, posting on publichealthjobs.org might not help them get someone to a rural area of Tennessee. It may, but it seems like they're investing their time in their more local social networks than public health jobs.
Yeah, and I think, again, the context of where you are is so critical. And then also the job wrapping that Paulani mentioned, so again, you could be posting them in multiple places. So it's no extra effort if you can do that. Because, it doesn't hurt to put it there, but right, you wouldn't post it in the national one and go, okay, now I'm done. So again, building those relationships. I just put the links.
Put the correct link in the chat.
There's two, yeah. There's
Okay, great.
careers, and then there's also public health jobs. Yeah.
All right. Thank you all so much for sharing your insights and suggestions. We've got just a couple minutes left, so I'm going to put up on the screen a little bit of information about the upcoming webinar in a couple weeks. This is the third webinar for year 2, and there will be, I believe, one more after that as well. So I'll leave this up here. It has the QR code, and I think Nicole is putting the link to register as well in the chat. But while this is up, I just wondered if you all wanted to share sort of anything about dissemination and how materials related to this work will or are available, and any next steps that you all have coming up to build on this work.
Yeah, so first of all, just like we talked about applying to a job and it's a black hole, these webinars can be a little black hole-ish. So as Val already said, You know, if you have feedback or things that are frustrating, things that are working, we would love to hear from you. I put my email in the chat, but contacting any of us, because it would be super helpful for us. You guys are the ones out there living it, so we want to make sure that we're reflecting it right. As for products and things, so our year 3 is included in building some toolkits and some case studies and examples and things. So we'll be continuing to share that. We will be putting out a publication to kind of disseminate these findings and make sure that it's in the literature. And then again, we'd be open to suggestions. We often present at national meetings and things, but if there's other things that you all that we could do that could be helpful specifically, please put them, share with us. We'd love to hear it.
And the manuscript that we are working on is just nearing being ready to be submitted. So we're a few months out from seeing that out in the public's domain. It will be an open access publication, and so it will be available to anybody without a fee.
And if there is anything in particular that we could share that could be helpful to you all to go back and make some of those more structural changes that we've talked about, like a one-pager or, as Val said, our manuscript will be coming in. But, you know, please do keep us posted because we'd be happy to try to help support efforts for these kinds of changes. And I know sometimes it's helpful to have an external document, so we'd be happy to disseminate that also. Just please keep us posted.
All right, well, thank you so much, everybody, and thank you to our presenters, Paulani, Val, and Beth. And feel free again to register for the next webinar. The slides will be distributed after this, as well as a link to the recording of this session. So thank you, everybody, and have a great rest of your week.
Thanks very much,
Thanks,
Casey.
everybody. Thanks.
Bye, everyone.